Did you know that up to 6 months before the end of their lives, many elderly people begin to show important emotional and physical signs? These signs can go unnoticed, but they are essential for family members and caregivers to provide more comfort and support during this delicate phase. In today's video, we will show you the 6 most common signs that elderly people show before death, explaining each one clearly and objectively. As life approaches its natural end, the human body undergoes a series of physical and emotional changes. One of the first and most noticeable of these changes, especially in older people, is increased fatigue and the need to sleep long. This symptom can often be interpreted as simple tiredness or laziness, but it is actually linked to a much deeper and more significant process. With aging and the progressive failure of organs, the body begins to prioritize vital functions, conserving energy to keep basic processes functioning. As a result, activities that were once simple, such as walking to the kitchen, taking a shower, or even talking, begin to require much more effort. As a result, older adults begin to feel more tired, even without strenuous physical activity. This intense fatigue leads to long periods of rest, and the increased need for sleep becomes increasingly evident. It is common for family members to notice that the elderly spend much of the day sleeping or awake but lying down and unwilling to get out of bed or off the couch. This behavior can be cause for concern, especially among those who do not yet understand that this increase in sleep time is part of the body's natural shutdown process. During this phase, metabolism slows down, blood circulation becomes slower, and breathing becomes shallower. The body understands that it needs to conserve energy, directing limited resources only to essential organs. As a result, the elderly feel extreme fatigue, which does not improve with rest, and gradually lose interest in activities that were once enjoyable or routine. For family members and caregivers, this sign can be painful to observe. Seeing a loved one who was once active and full of life now sleeping most of the time can arouse feelings of sadness, helplessness, and even frustration. However, it is important to understand that this change is part of a natural cycle, and that forcing the elderly to stay awake or perform activities beyond their capacity can cause more suffering than benefit. The role of the caregiver at this time is to ensure that the elderly person rests comfortably and peacefully, adjusting pillows, keeping the environment quiet and pleasant, and helping them change position to prevent skin sores are simple actions that make all the difference. And even if they spend most of their time sleeping, small gestures of affection, such as holding their hand, stroking their hair, or just being present, communicate love and care, even without words. In addition, it is important to watch for other signs that may accompany extreme fatigue, such as difficulty swallowing, irregular breathing, or mental confusion. These symptoms may indicate that the decline is intensifying, and it may be time to seek medical advice or specialized palliative care. It is essential that family members understand that increased fatigue and sleep time do not necessarily mean that the elderly person is giving up or discouraged. It is a biological process in which the body gradually reduces its activities to prepare for the end of life. Respecting this moment by offering physical comfort and emotional support is one of the most beautiful and humane ways to show love and gratitude for everything that person represents. Another very common sign that may appear months before the death of an elderly person is a significant reduction in appetite, accompanied by weight loss. This is one of the most visible signs, and often the one that most concerns family members, as it directly affects our idea of care. After all, we learn from an early age that feeding someone is one of the most basic forms of love. But it is important to understand that at this stage of life, a decrease in appetite does not happen because of neglect or emotional disinterest. It is part of a natural physiological process in which the body begins to slow down its functions. The digestive system, like other organs, starts to work more slowly. Digestion becomes more difficult, metabolism slows down, and as a result, the body requires less energy and nutrients. This causes hunger to decrease, and the desire to eat gradually disappears. Many family members try to insist, offering favorite foods, vitamins, supplements, or even trying to force the elderly person to eat more. However, it is important to understand that this refusal to eat is not an act of resistance or stubbornness. It is the body silently telling us that it no longer needs as much energy to sustain vital functions. Another factor that contributes to a reduced appetite is a change in taste and smell, which is common in aging and even more prevalent in the final stages of life. Food no longer tastes the same, and many foods cause discomfort, nausea, or simply cease to be appealing. In addition, difficulty chewing, swallowing, or dental problems can make eating a challenge, leading older adults to prefer liquids or even refuse their favorite foods. Weight loss, which accompanies this reduction in appetite, can be quite pronounced. The body begins to use fat reserves and later muscles as a source of energy. Therefore, it is common to notice a decrease in muscle volume, generalized weakness, and in some cases the appearance of skin wounds due to loss of mass and protection. For caregivers and family members, this process can be painful to witness. Seeing a loved one losing weight and strength can arouse feelings of anguish, sadness, and even helplessness. But it is essential to understand that trying to force someone to eat can cause more suffering than good. Forcing someone to eat when their body no longer feels the need can cause choking, abdominal discomfort, vomiting, or even serious respiratory infections such as aspiration pneumonia. The best thing to do in these moments is to respect the elderly person's wishes, offering small portions of light, easily digestible foods, always prioritizing comfort and pleasure. Instead of focusing on quantity, the most important thing is to ensure that each meal is a peaceful experience, without pressure or demands. A spoonful of soup, a sip of juice, or even a small piece of fruit can be enough if offered with love and attention. In addition, it is worth remembering that hydration can also decrease, and older adults may drink less fluids. Keeping the mouth moist, offering natural fruit popsicles or small sips of water throughout the day are gentle ways to promote comfort without unnecessary insistence. At this point in life, the most important thing is no longer to prolong life, but to ensure quality in the time that remains. Respecting reduced appetite and weight loss as part of the natural process of saying goodbye is an act of profound love. As the end of life approaches, the elderly person's body begins to show even clearer signs of wear and tear. One of these signs is increasing difficulty in performing everyday tasks, even the simplest ones that have always been part of their routine, such as getting out of bed, bathing alone, walking to the kitchen, or changing clothes. This limitation does not appear overnight. It sets in gradually. The elderly may begin to avoid climbing stairs, take longer to get dressed, or even ask for help more often. As the days go by, they become increasingly dependent on family members or caregivers to maintain their hygiene, nutrition, and even their mobility within the home. It is as if the body is slowly shutting down, reducing its ability to respond to the commands of the mind. Muscles lose strength, balance becomes unstable, and the risk of falls increases significantly. Even fine motor skills, those needed to hold cutlery or brush teeth, can become a challenge. This loss of autonomy is deeply felt by many older adults. They may feel frustrated, embarrassed, or sad that they can no longer do things on their own that were once natural. And this frustration can have a profound emotional impact. For caregivers and family members, it is essential to understand that this process is not a sign of laziness or discouragement, but rather a real manifestation of physical decline. Instead of demanding independence, it is best to offer support with respect and sensitivity. Allowing older adults to participate in tasks to the best of their ability, even if it is something as simple as combing their hair or choosing their clothes for the day, helps preserve their dignity and self-esteem. At this point, adapting the environment can be a valuable step. Installing grab bars in the bathroom, avoiding slippery rugs, keeping personal items within reach, and arranging furniture in a way that facilitates movement. Every little gesture contributes to making the routine safer and less stressful for the elderly person. However, as the difficulty in performing basic tasks increases, it is common for the elderly to begin to withdraw. They may avoid social interactions, refuse visitors, stop participating in family conversations, and gradually isolate themselves in their own silence. Often, this withdrawal from social life is not only physical, but also emotional. This transition between loss of autonomy and isolation is a delicate point, and that is exactly what we will discuss next. Social isolation as one of the emotional and behavioral signs that mark this moment in life. Another sign that may appear in the months leading up to the end of life is social isolation. Although this behavior can be confused with sadness or disinterest, it is part of a deeper and often natural process at this stage of life. Seniors who previously enjoyed talking, receiving visitors, or participating in family activities begin to withdraw. Gradually, they begin to prefer silence, their own room, and their own company. Conversations become fewer, responses become shorter, and in some cases they even refuse to see friends and close relatives. There can be several explanations for this isolation. From a physical standpoint, loss of energy, constant fatigue, and difficulty moving around make interactions more tiring. Just the effort of staying awake and alert already demands a lot from the body, which causes older adults to choose to conserve energy by limiting their social interactions. But there is also an emotional and psychological dimension to this withdrawal. Many older adults consciously or unconsciously begin a process of saying goodbye. They start to reflect more on their lives, their memories, and their choices. This period of introspection can lead them to seek moments of solitude as a way to organize their thoughts and emotions. In addition, isolation can emerge as a protective mechanism. In some cases, older adults avoid contact with others so as not to burden them with their frailty, or even to spare themselves the emotional strain of saying goodbye. They may fear becoming a burden, or simply feel that they need this space to accept their own mortality. For family members and caregivers, this withdrawal can be difficult to understand and often painful. Seeing a loved one isolating themselves can generate feelings of rejection, concern, or even guilt. It is important to understand that in most cases, this isolation does not mean a lack of love or interest, but rather an internal need of the the elderly person themselves. Respecting this moment is an act of love and care. Being available, without intruding, is essential. Even if they don't want to talk or interact, your silent presence is still valuable. Sitting next to them, holding their hand, offering a kind smile without pressuring them for answers or conversation can convey security and acceptance. It is also important to observe whether isolation is accompanied by deeper signs of emotional distress, such as intense sadness, hopelessness, or prolonged apathy. In such cases, it may be necessary to seek professional guidance to ensure that the elderly person receives adequate psychological or spiritual support. This isolation, however, is often not just a withdrawal from people, but also a gradual withdrawal from the outside world. The elderly person may lose interest in news, TV shows, and hobbies they once enjoyed. It is as if, little by little, they are closing cycles, disconnecting from responsibilities and everyday concerns. As the end of life approaches, changes do not only occur in the physical body. The emotional universe of the elderly also undergoes profound transformations. Intense, sometimes contradictory feelings arise during this period. Understanding these emotional changes is essential to providing more humane, welcoming, and respectful care. It is common for older adults to oscillate between moments of sadness, fear, irritation, acceptance, and even peace. These emotions reflect the confrontation of an inevitable reality, the finitude of life. For many, this is a difficult process that awakens insecurities, regrets, and reflections on the past. Some older adults may express deep sadness, lamenting lost opportunities, mistakes made, or broken relationships. Others may feel guilt over unresolved situations or hurts that have not been healed over the years. This sadness, however, should not be immediately confused with clinical depression. It is often a form of anticipatory grief, a way of saying goodbye to one's own journey while there is still time to think and feel. Fear may also be present. Fear of pain, fear of suffering, fear of the unknown. Questions such as, what will happen to me? Will I suffer? Will I be alone? May echo in the silence of their thoughts or arise in delicate conversations. At times like these, emotional support, attentive listening, and non-judgmental acceptance are essential. On the other hand, there are those who experience moments of irritation and impatience. The loss of autonomy, physical limitations, and dependence on basic care can lead to frustration and anger. Small, everyday situations, such as needing help eating or going to the bathroom, can trigger feelings of helplessness and rebellion. It is important for family members and caregivers to understand that these behaviors are not directed at them, but rather manifestations of the internal suffering that the elderly person is experiencing. But not all emotions are difficult or painful. Many older adults also experience moments of acceptance. They begin to talk openly about death, organize unfinished business, express wishes, and say goodbye. This period can be surprisingly peaceful, as if by accepting their own departure, a weight has been lifted from their shoulders. Spirituality can also take on a central role, not necessarily linked to a specific religion, but in the sense of seeking meaning, reconciliation, and inner peace. Some older adults feel the need to pray, talk to spiritual leaders, or just reflect in silence on the meaning of life and death. For those who are close to them, these emotional changes can be challenging. Sensitivity is needed so as not to invalidate the feelings of the elderly or minimize their pain or anguish. Care at this time is not only about medication or procedures, but also about giving them space to feel, talk, cry, reminisce, or simply withdraw. And something curious happens. Between these emotional highs and lows, between sadness and serenity, many elderly people experience moments of clarity and peace, even in the most delicate stages. These are moments when they seem more present, more lucid, as if they had one last breath of energy and consciousness. These moments are special, and in the next topic we will talk about them, what they are, how they happen, and what they mean for the elderly and their families. Among the many physical, emotional, and behavioral changes that mark the last months of an elderly person's life, there is a phenomenon that, for many family members and caregivers, can seem almost inexplicable: moments of clarity and peace. These moments often occur after a period of great frailty, mental confusion, or seclusion. Suddenly, the elderly person seems more alert, more lucid, with a more attentive gaze and clearer words. It is as if, for a brief moment, the mind and body reconnect, allowing them to express thoughts, feelings, or even farewells that seemed inaccessible until then. This phenomenon, also known by some health professionals as terminal lucidity or death rally, is reported by many families around the world. The elderly person who had been sleepier, quieter, and less interactive for days suddenly wakes up, asks for food, talks to family members, recalls old stories, or shows deep serenity. For family members, these moments are a true gift. They are often used for important conversations, reconciliations, expressions of gratitude, and farewells. Some elderly people take advantage of this clarity to give final instructions, express last wishes, or simply say, "I love you," that has not been heard in a long time. But it is important to understand that despite this apparent improvement, moments of clarity do not mean recovery. They are part of the natural process of the body and mind, preparing for the final shutdown. Therefore, it is essential to enjoy these hours or days with presence, without creating expectations that the overall picture will change or reverse. In addition to mental clarity, many elderly people show a state of inner peace. Even those who have experienced moments of fear or distress may, in their last weeks or days, express surprising serenity. It is as if, by accepting their own departure, they find emotional relief, a lightness that allows them to leave in peace. This state of peace can manifest itself in different ways: in a calmer gaze, in the absence of anxiety, in comforting words, or even in the simple act of holding the hand of those around them in silence without the need for further words. For family members, witnessing this serenity can be a comfort amid the pain of saying goodbye. These moments are also precious opportunities for those who remain. They allow us to look into each other's eyes, say what has been left unsaid, reaffirm our love, ask for forgiveness, or simply give thanks for the history we have shared. These moments, though brief, can become eternal in the memory and heart of those who experience them. And when these moments of clarity and peace occur, they often indicate that the cycle is coming to a close. The body begins to show more obvious signs that the transition is approaching: changes in breathing, skin color, consciousness. That is why, more than ever, this is a time to be present, to respect, to welcome, to allow the elderly to depart with dignity and love. And that is precisely what we will discuss next: how family members can offer support in the last days and hours of life, ensuring that this moment is lived with care, respect, and above all, compassion.